Good morning. I hope I'm clear from the other side. I just want to ensure that I'm clear before we start the class. Confirm for me, class. Am I clear? Are you getting me? I'm waiting for someone to confirm by. Okay, thank you. I have seen you've confirmed that I'm clear. I want to say thank you. Welcome you to this class. We left like with 8 minutes. Our apologies for that. The wrong link was sent to you, which could not manage all of you. So today I'll taking you through topic 8, impact of HIV in different sectors. So far we have gone through various topics. We have gone through the origin, relationship between HIV and the immune system, how abuse of drugs are related to HIV and AIDS, maybe transmission and its suppression of its medication. So today I want us to go through how has HIV negatively, or when you talk about impact could be either to the positive or to the negative. So I want us to go through how HIV has impacted various sectors. We'll see how it has impacted the education sector, the health sector, the population, and then we'll finish by now discussing HIV as a national disaster so that we understand what is a national disaster and what has caused the HIV to be declared as a national disaster. And then maybe by the time we are coming to the end of this topic, you'll type and let me know whether you think HIV is still a national disaster or we should be moving on to other diseases that are actually rampant now, like cancer and other form of diseases. Recently, Corona was the main thing, but I think it is really going down. So as we go, by the end of the lesson, we will agree what should be declared as a national disaster and if still HIV is a national disaster. So welcome to the class, and we will start by discussing the impact of HIV on education sector. So the first point is the teacher posting become increasingly difficult because you find out that because HIV does not segregate, anyone can be infected, and definitely when we have many teachers to medication, they need a place where they can easily be assisted. So it becomes difficult to know where to post them. And when it comes to posting someone who's positive, you have to ensure where you're posting them. It's where they are more comfortable and they can access medical services. Another thing, the loss of trained and experienced teacher and interruption of teaching programs due to illness, which end up reducing the quality of education. It's evident that when we have many teachers being infected, and at some point when someone gets maybe to the full-blown stage, maybe some are not even taking their medication, you see, we end up losing life. And as we are losing more lives, the number of trained teachers, personnel, actually going down. And maybe you can find out, maybe that teacher had taught like for 10 years. So you can imagine someone who has taught like for 10 years is an experienced person. So we end up losing an experienced personnel. Number 3, the HIV epidemic will require a change in the content and the role of education. Automatically, it will change the curriculum. I think now we are moving to CBC. Every time, time is evolving, things are evolving. So as HIV becomes an epidemic, definitely the curriculum has to be changed to suit the current condition, maybe to show people how to manage the disease, how to make decisions on certain things. So it ended up changing even the curriculum. And that's why I think we're having it like in school. And why it started in school from long time ago, because they realized HIV was a major thing, and it was important like to ensure it is in the curriculum, so that students who get into campus like first year, they are informed well. Like when you come here, freedom is there, but remember, it's your life. There are consequences of every action. So you see, even if someone chooses to be ignorant, at least they've been taught because it is in the curriculum. Okay, now I want us to go through their impact on education at regional/local level. So at regional/local level, teacher absenteeism. It's evident that people who are living with AIDS are often periodically ill, like they're almost sick, because when you're positive, your body is not immune to many diseases. So you end up contracting TB. You are out of TB or into another infection because your body cannot fight many infections. So maybe today you took the medication, tomorrow TB was up. You end up missing school. Maybe after 5 days you're able to go, another after 2 days you are unable to go. So you see, as a teacher, you will not be able to attend to your lesson. People living with AIDS are often ill. When teachers are absent due to illness or medical treatment, the children are often left without schooling due to shortage of teachers' replacement. Another point, children drop out or never enroll in order to nurse their sick parents. If you watch documentaries, maybe seeing people who are infected with AIDS, like maybe you find out parents are infected. Definitely, one, you don't expect that child to be emotionally stable. Secondly, maybe the parents are not well up, so the child has to drop out of school to take care of their parents. So it actually disrupts the normal routine of that student, so they end up dropping out of school. So another point, children drop out of school to engage in income-generating activity. As I've said initially there, the parent is not well up, the parent is very sick, so the child has to drop out of school. But secondly, the child has to get engaged in activities to generate income, to take care of their parents. And that's how you find very young children selling things at the market just to be able to provide for their ailing parents who are sick at home. Another point, in the rural area, AIDS illness in the family will demand greater participation from children in seasonal agricultural work. As I've said, so children, they will be kept at home and they will have to work and they will continue missing out on school. So HIV is indeed a disaster. Another point, children drop out due to the cost of schooling. If a family member becomes severely ill, definitely there will be not enough sufficient funds to cater for that family. So we expect that child will drop out of school because even the parent, him or herself, cannot take care of the student's need, the kid's needs. Another point, children from AIDS affected families are under emotional strain. As I've said earlier, when a child knows the parent is positive, and that is just an emotional instability for that child. So that child will be worried most of the time because they don't know whether they will go back, find their parent still alive. So they are not even stable emotionally, they are disturbed. So they cannot even concentrate in school. So you find, I want to imagine like someone tells you your mother has cancer positive. You as a child, you'll switch off. You'll start imagining the worst. So I think this is the same thing that happens for a child whose mother is positive. So children with AIDS are frequently kept home from school due to illness or taken out of school. So now here we are seeing it is not just the parent who is sick. From other points, we've been seeing maybe the parent is the one who is sick, so the child is dropping out to take care of the parent. But now here, you can find out that the same child who is expected to be in school is the one who is sick. So the child ends up dropping out of school because they're always in and out of school. Sometimes, as I've said, when you're positive, your health is it keeps fluctuating. Sometimes it's okay, sometimes you're down. More so if you don't have an access to medication to be able to control the viral load, you will not be able to predict how tomorrow you will be. You'll not be able to predict what will be affecting you tomorrow. So that child will be in and out of school. HIV is decreasing the demand for education. So you've end up, if many kids are dying out of HIV and AIDS, meaning the population of children needing education, it's also dwindling, it's also going down. Definitely it will affect school enrollment. Studies both pre and post, like when many students or children are dying out of HIV and AIDS, demand for education goes down, and that now the next point. Also, school enrollment will go down. It will decline as a consequence of the pandemic. I've underlined that statement. Another point, school attendance. Definitely, it will go down. This child who is sick will be in and out of school. So if you're to mark a register, you find out maybe they are there on Monday, Wednesday, you don't find them, Thursday, they are there. So I hope you're differentiating the statements where, like the first one, I'm saying it is decreasing the demand for education because more students becoming sick or more children becoming sick, many of them dying. So the level at which education is needed by this student, it's negative because they actually. Another statement, out of HIV and AIDS, you do expect when they'll be enrolling students to school, you expect the enrollment to be down. Another statement I've said now, these children who are sick, who are going to school, they'll be in and out of school. So you don't expect them to be like in throughout because sometimes they're not feeling well. Yeah, dropout. And there are those who they come to a point they drop out of school. Like now they can no longer, maybe they are really the HIV has really worked on their immune system. It can no longer fight. They've become they are so sickly. Finally, they end up dropping out of school. Another point, in the local region, the number of teachers, it will go down. Teachers, like many others, are not spared by HIV, so that even if facilities continue to be available, there may be a lack of teachers and other personnel. I hope that statement is clear to provide teaching services. We also have people who are called education managers. HIV does not spare any personnel. So you like maybe we have the CUPET, people who manage education, maybe university, it's called Public Commission of University. Those are the people who manage universities. When they get infected with HIV and AIDS, they will die, or sometimes even they take earlier retirement. So personnel in the management of education institutions, they're also not immune from both direct and indirect effects. Death cases have been reported at all levels. So HIV can destabilize. We have seen it can destabilize from the family level to the education level, to the management level. It can destabilize anyone. No one is immune to it. Okay, so I wanted us at this point. I want us now to see the relationship between the social economic factors. The social economic factor, its relations to HIV and AIDS. So the first statement is ignorance, whereby we find out even after people being aware that HIV, you can transfer it from one person to another. You find out like people are really ignorant. People don't care. They go clubbing. You are drunk. You end up infecting each other. You sleep without protection. I remember telling my class, not all sexual activities results to HIV transmission. We only say unprotected sex. So even when you'll be handling your exams, don't just say sexual activity with a positive person will make you be infected. No, it must be unprotected sexual activity with a positive person will make you be exposed to the HIV and AIDS. So we see, even though a majority of population know about HIV, people, they ignorantly continue to participate in activities and practices that encourage this transmission. Another point is illiteracy. Illiteracy, as the Bible says, my people perish for lack of knowledge. Sometimes, most of us who are maybe exposed to education, we are lucky. I'm telling you, you will go to places whereby people actually lack knowledge. Maybe there are people who don't go to school, this marginalized area. So you find their girls are very innocent. People come cheat them. they don't know what to expect, and then they end up innocently being infected. So illiteracy level is still high with some people, still having no idea of how HIV is transmitted. So not everyone has the know-how of how HIV is transmitted. Another thing is poverty. You find many people even succumb to selling their bodies just to put a meal on the table. So especially in the developing countries, one country that is known for HIV and AIDS is South Africa country. I was listening to a documentary that was saying HIV in South Africa is like coughing. It's like someone can infect you by coughing, but not necessarily that you can be infected by coughing. Like they try to show you how people there, when they are positive, they don't even hide it. They talk about it, they take their medication so openly. Like HIV in South Africa is not a big deal because people there are very careless. So I think at some point the rate of infection was so high, and more so in those areas affected by poverty. And poverty was another thing that actually led to the transmission of this HIV in South Africa. Yeah. So poor are often forced to do anything to earn a living, even engaging in unprotected sex. Yeah. Another thing is the stigma and denial. So stigma, when people but I'm happy nowadays HIV is not really as it used to be. Nowadays people think they think, which is actually true, cancer is even more dangerous than HIV because initially when someone will know you have HIV, they will just segregate you. They won't want to associate with you. They will fear everything, even what cannot. Like if someone will fear even to share a spoon with you, even to drink water using the same cup. I'm telling you, you will not get infected by sharing a spoon or even using the same plate or swimming in the same swimming pool. You need enough threshold of viral to transmit to someone to make them positive. And that's even when, by kissing someone, you need, like I was telling my class, you need 1 liter of saliva while kissing to transmit virus from one person to another. So sometimes I think the stigma just associated with HIV is the reason as to why many people are even dying earlier. So it really remained high. So many people do not go even for the testing, and even some choose not to go for those medications. They are like, let me live until I die. So I think it's high time, as we are getting educated, let's try to kill this thing known as stigma. Another thing is cultural factors. Like when you come to Africa, I think Africa is the room of cultural practices. You go to South Africa, to Congo, you come to Kenya. We have these practices like polygamy, wife inheritance in I don't know if it is still there, but in Nyanza. Also, at some point, statistics showed that people coming from Nyanza were HIV there was so high in Nyanza. Majority of people from Nyanza were infected with HIV and AIDS. And the thing that really brought that thing was this positive. And that's how many of them actually were infected. And then also definitely the polygamy practices whereby you have them man marrying 10 wives, maybe one of them is positive, or assuming the man is done is positive, ends up affecting the whole family. Yep. Lack of access to maternal services. This is another thing, and mostly I'm happy what the former first lady, the one who just left, Mama Uhuru's wife, Margaret Kenyatta. She really put emphasis on maternal services for women, and it has really improved. I think that's to the positive side. So women, especially in rural area, they lack this proper access to maternal services. So when we normally say a mother who is positive can give birth to a healthy negative child, but during delivery, when things are not handled well, they might end up infecting the negative child. So we really hope that these maternal services can go to those areas. Another thing, the tribal conflict and the civil war, definitely yes. Like this, the massacre war, when you have the same panga slashing 10 people, one person was positive, you expect it to be spread to all those people. So I think even during this, in countries where they experience a lot of tribal conflicts and civil wars, the disease was really spread very fast. Now, I want to go through impact of HIV and AIDS on the health sector. One is the personnel cost. So the HIV/AIDS related personnel can broadly be categorized in terms of absenteeism. This person, that nurse that you expect to find in the hospital, if they are sick, definitely you will not find them there every time. And even when they are not in good health, they are not able to attend even to the sick people. So it really medical benefit, death-related benefits. When someone is now sick, you really sometimes you have to give them earlier retirement so that they go and relax. Sometimes the health benefit related from, like if someone was attending to a patient who was positive and they end up being positive, there's some bit of compensation they are supposed to receive. So you can see the kind of economic burden that is placed as a result of that patient maybe having interacted with a positive, that nurse having interacted with a positive patient and getting infected. Another point is efficiency of public services. HIV/AIDS increases the number of government employees taking early retirement. Definitely, yes. Yeah, because when someone cannot perform, the best thing is to go home. Not because they want, because they are not in good health. Definitely, it will lead to what? It will lead to workload. If you had 10 nurses or 10 doctors and 3 of them have died or they've taken early retirement because of the infection, what do you expect? The remaining 7, they will have to overwork. Like they have to take up their normal work plus what the other 3 used to do. Because sometimes replacement is not like instant. It takes time before you see replacement. Another thing, morbidity and mortality among health workers. In many countries, the health personnel have high rates of HIV infection. Yeah, these people, it's by the grace of God, because as they work, they interact by these people who are positive, having to nurse them, having to inject them. Sometimes they can end up injecting themselves with the same needle and transferring the same infection to them. And sometimes you see they get infected and they end up dying. Another thing is stress and burnout. Apart from staff death and absenteeism, stress and burnout resulting from stressful working conditions. I'm telling you, it's not easy. If those people really, you need to salute. I always say you need to salute medical personnel, because you can imagine when you visit those wards, because we have wards whereby we have patients who are positive, who are really in the full-blown stage. You know, they cannot even go home. Some have open wounds. Some cannot even they cannot even move themselves. They need this personnel to move them. It's not easy for those personnel, medical personnel. Another thing is stigma. Like if one of the medical personnel realize that he or she is positive, or people realize, you see, they start stigma, like segregating themselves from him, like that stigma, they start avoiding him or her. And honestly, it will really become difficult for that person even to continue working in that place. Another thing, there is that risk and fear of contracting HIV and AIDS. You see, you can imagine, it's just by grace that you are safe, because you can imagine every day you have to, you handle patients, some from accidents, maybe then they are positive. Maybe you as a nurse, you have maybe somewhere a wound, maybe you're not even aware. And you know, sometimes you have this fear and this worry, what if I get infected? What if I get into contact? So it's not easy. And another point, the workload, definitely, yes. When you have more people becoming sick, because sometimes it's not just from the other side, like the doctors having maybe to die or taking earlier retirement, but also we can have more people being infected. And definitely it will put pressure on the personnel, medical personnel who are there. Yeah. Another thing, it will increase demand for healthcare. It will. The more people are positive, the more people are infected. You see, someone who is positive, they need access to many things. They need access to good medical care. They need access to these ARVs. And they're also given supplements. There are those supplements that are provided by WHO mostly that can give them proteins as in balanced diet. So you see, it means like the governments will have to pump more money in that line. Then increases in health expenditures. Calculation by the World Bank suggests that the effects of HIV on total health cost is likely to be quite large. Definitely, WHO being the main body that that take care of this situation, they are able to give statistics whereby if we have more people being infected with HIV and AIDS, like they will say, we need more money pumped here. You see, something funny people don't know. These are given for free to Africa. But I'm sorry, our nations, our countries are just funny. We get medications for free, we still tax them, and we are getting them for free. We make it even more difficult for them to get to people. But we are hoping there is hope at the end of the tunnel. Systems will change and things will be better. I hope we're still together. I want us to check on the impact of HIV on the population. Now people are infected or people are exposed to this virus, what happens? Impact of HIV on fertility and reproductive choices. It will go down. Like you see, very few people who are positive decide to still give birth. Like I know when I've listened to stories, people who are coming up openly, sharing their HIV status, they're like, we are both positive, but we're having negative children, we are giving birth, we are taking our medication so well. But there are those who they fear. And also, let me be honest, it's very hard to find someone who is negative agreeing to marrying someone who is positive. So you can see it will really interfere with the fertility rate and the reproductive choices. Another point, impact on marriage and remarriage. Young people might be delaying marriage. When you want to do mostly these church weddings, they will tell you go get tested first. So you can imagine that people just fear. So that people will just delay to marry because they're like, I don't want to go get tested. Then you can imagine also someone when they go get tested and then they realize, what, I'm positive just before marriage. It will interfere with everything. And then family and household formation and building. Impact of HIV and AIDS has been anticipated on union formation, union instability and fertility. It's just an expounding of the initial point. HIV really interferes with family stability. If maybe the family members, maybe they are positive, they will choose maybe not to give birth to more children. The family is not stable emotionally, economically. The union is not really, like things are not normal. Yeah, sure. I think before I go to the last bit, we're almost finishing. I hope it's clear. We have looked how HIV has impacted education sector. Even at regional level, we have seen how it is affecting the health sector. We have seen how it is affecting families, how it's affecting population. And I'm hoping it's clear and I'm hoping you've understood. At the end, we'll be looking at maybe your reactions or your questions. So we have said that HIV continues to be a national disaster. Why? Let's first go through why. Let me just, When do you declare something is a disaster? I will just go back there. When do you declare something as a disaster? A disaster is any serious disruption of the functioning of a society, causing widespread of human, material, or environmental losses which exceed the ability of a society to cope up using its only resources. I hope you'll agree with me when we say HIV is a national disaster. Why? We are not even able to manage it ourselves. We rely on those donations. Those ARV, we rely on their donation. So first, why does this HIV? We have agreed that it's a national disaster. From the explanation of what is a national disaster, we agree that it's a national disaster. So why does it continue to be a national disaster? First, effective intervention to tackle HIV are not being targeted at the right groups. People have malice. I know of a scandal when Corona was at its peak, some money were distributed and apparently some people chose to steal those monies. And you see, they end up not targeting the right group. They end up not directing effort to the right people. So the effective interventions to tackle HIV are not being targeted at the right groups. In too many countries where the HIV epidemic is concentrated in high-risk groups like sex workers injecting, you see, these are the key people. These sex workers, injecting drug users, these homosexual, you see, like, efforts are not directed there, and these are the people who really increase the spread of this virus. Then second, the money for HIV is not flowing from donors to community. Yeah, they give money to help these sick people to buy supplements for them, but money does not reach them. It gets lost by air. Then third, groups at high risk of contracting HIV, they continue to face stigma and discrimination. So efforts to control HIV are hampered because these groups are criminalized and have little or no access to HIV prevention and treatment services. I know that is so clear. Yeah, so that's what we were saying. Why is HIV epidemic formally a national disaster? And we've said how United Nations described something that qualifies to be called a national disaster. So what are the components of a formal disaster management framework include? There are three main components in a formal. When you want to manage a national disaster, there are three main components. The first one, you have to officially recognize something as a disaster. Like, you have to recognize that HIV is a national disaster. Then secondly, now you have to come up with policies. You have to enact appropriate policies in action to handle that national disaster. And then thirdly, organizing an appropriate management system so that you are able now to tackle the disaster. So you have first to recognize it as a disaster, then you come up with policies, and then now it's like now realizing the goal, now organizing an appropriate management system to go ahead and tackle that disaster. Disaster management framework. First, the disaster management framework includes official recognition as a disaster. When faced with a serious disaster, country, they often declare a formal state of emergency. Like when we suffer from hunger, if you always see the president giving brief, like if we are suffering from hunger, we just declare we are hunger stricken. So when faced with serious disaster, countries are expected to declare a state of emergency so that even the other nations, they can come in and help. Yeah. Declaring a state of emergency in a country plagued by HIV and AIDS could help catalyze a response in several ways. Yes. So if we are, like when we were suffering from Corona, you can see every country was, why was every country, apart from very few countries like Tanzania, majority, they were declaring, yeah, Corona is really working on us. We are enforcing curfews. And I remember we just hear our president saying, I'm adding more 30 days. And you really feel like working on him. So when you declare it's a national disaster, and that's why they were able to go and get more money and leave us in more debts. Then lastly, managing the HIV epidemic as a disaster. Disaster response teams typically adopt a streamlined and centralized management system known as incident command system. So several components of this type of management system could have a beneficial effect on the HIV epidemic. A key characteristic of the incident command system is that it minimally disturb existing infrastructure but can draw on sectors and integrate all major stakeholders. The problem of a country declaring a national disaster, it will attract the right people. The UN nations, they will come in, European unions, they will all come in and assist where they can assist. Then encouraging use of a disaster management to combat HIV. When you declare a state of emergency, it forces the government to publicly admit that their country is in a vulnerable condition, which may lead to strained international trade ties. So what they normally emphasize, if we are maybe, like if we are I think at some point Al-Shabaab was the main thing. You see, it was important for our nation to declare that our security is not okay, so that we don't have investors coming and then they get attacked, so that they are aware we are not safe, and then they can see how they can help us. Yeah, so that was the end of our class. I will just go through your public chat and maybe go through your question. Yes. Any question, you can type it. Any question? Any question? Someone is saying, excuse me, madam, but eating cause transmission, but only by eating food that has been chewed. Yeah, what I was saying is this. Some of us, we have beliefs that are not real, and that's why we really end up stigmatizing people who are positive. I have said, just by sharing a spoon with someone who is positive won't expose you to the HIV virus. Another thing I said, though it is good if you avoid, but sometimes you can succumb to fear. But I know someone has said eating chewed food. Yes, I don't want to assume you can, why should you even eat some food that someone has already chewed? Surely, let's not even get there. It can or it might not. But I was talking about even sharing a cup, sharing a plate, sharing a spoon, swimming together. There are this fear people really have, which is not right. Yes, I can see many are typing their names and registration number here. Are we going to sign the attendance? Some of you have funny questions. When it comes to signing your class attendance, that one you do it with your lecturers at your class. And I know some of us will give to our class reps so that it's easier for you guys to sign and then you surrender to us. Excuse me, madam, please take us slowly. You are too fast. Oh, I'm sorry for that. Yes, Purity Sami, it depends. Nice lecture, thank you. How can HIV pass through flu? Oh, I was saying in South Africa. No, it's just what can I say? It's just a statement. Like HIV is so rampant there until people are like, it's like nikama homa. It's just a statement. Like they are so used to it. It's not like in other nations people are really afraid. South Africa is really affected with HIV and AIDS, so like they really don't take it as a big thing. That's what I was meaning. Has the first 12 countries managed to curb stigmatization and discrimination due to this disease? I can say, I think it's a work in progress. Some nations are really trying. I have seen even big people, they're not, these influencer people coming out clearly. Maybe and most of them, I've listened to them, they are homosexual. They come out clearly and they really speak out, like they are positive. Some you are not even aware they are positive. So some are really coming. I think nowadays, as I'm saying, even in Kenya, I want to appreciate it is not like the other time. Nowadays, people don't take HIV as a matter of life and death. I'm happy people are really embracing it and taking medication, and people are moving on. Thanks for the wonderful lecture. Thank you. Nice lecture. Thank you. So South Africa has the highest figures of positive victims. I haven't checked the recent statistics, but you can Google. But in South Africa, HIV, it's like flu. That's what they say. It's many people are positive, and they were saying it's because of the poverty. That area that is really struck with poverty, many people are really infected. Yeah. The lesson terrific, you guys. No, just you need to know so that you can be more careful. What amount of saliva leads to this? I was telling you, you need at least but also don't go kissing carelessly. You see, when someone has wounds, you cannot prevent yourself. Thanks a lot for the lecture, madam. Welcome. Can someone HIV with flu transmit because we are fierce? No, you don't like live in fear. Just do the right thing, take care of yourself, and all will be well. Thank you. That was a wonderful lesson. Thank you. At the start, I was a bit fast. I'm sorry for that, but I'm happy Mupata. Thanks a lot for the lecture. Welcome. I want question. Do you have tutorials? Yeah, that one you can communicate with your lecturers. The class is very nice and interesting. Thank you. Question, please, madam. On the impact of HIV on health sector, elaborate more about efficiency in public service. When you have this medical personnel becoming sick, 1, absenteeism is there. 2, if they got infected while carrying out the service, that they will have to be compensated. And 3, maybe they are on and off, and even some go to early retirement. Yeah, can hug transfer disease? Now you are joking. You cannot. Thanks a lot, great one. The lecture is interesting. Welcome. What about marked script? That one you'll ask your lecturers in your class. Okay, what are the impacts of HIV in the field of agriculture? Nice one. Thank you for thinking abroad or thinking widely. It will affect, definitely, when you have people infected, people will not go to the farms. They will not be able to plow, and definitely will end up not having food. Yeah. So actually HIV affects, it's only that we selected the sectors that are heavily affected, but HIV affects everything, everyone. Yeah, because if you have people dying out of it, people want even if, imagine, God forbid, if it was to take away our leader, maybe I don't want to mention any name, you can imagine it will bring our nation to some standstill. So it's not a good thing. The same as what cancer does. You see, it just took away Bob Colimo like that. So it's HIV, it affects everyone. Are we going to get our marked script? Definitely, they will return back to you. Thank you so much. The lecture was fantastic. Thank you. Can cancer be referred as cancer? It's a disaster. Actually, I think I'm hoping in the future we'll move from HIV just to even cancer, because cancer is now the main thing. You have many questions. In which circumstances HIV positive person cannot transfer? Oh, they normally say, I hear some are just carrier. Second, if someone has been taking their medication well until their viral load is undetectable, they cannot transfer HIV and AIDS. And we have some who are just carrier, they also don't transmit. How long can a person stay with the disease without the signs? I think for me it depends. Depends with the health of a person. Yeah, but that is something you can study more on. Thanks, Doctor. The class was good, and thank you. The lecture was more than wonderful. Thank you. Yeah, thank you for your also positive compliments. I appreciate. I hope you enjoyed the class. I was taking you through was Madam Susan. So is Corona a disaster? I doubt. I want to finish and you're still asking questions. Corona is not a disaster. I don't think it's a disaster. It was a short-term disaster because I think most of us have really moved on. Yeah, a disaster really brings a nation to a standstill. But we still need to take care. Yeah. How do you prepare? I think the best thing for you, for where you start from, don't start imagining what are the signs of HIV and AIDS, because even some people, they cough and they're not positive. I think for me, the best thing, if you suspect yourself, just go and get tested. Yes, and then from there, because there are people psychologically die out of diseases they don't have. I know of someone who almost died because they thought they were positive, because they were told someone slept with someone and they were told that person was positive. And that person almost died psychologically. The person tormented herself. So one day that someone told that person, just go get tested. That lady felt so bad when she realized she was actually negative. and she has been thinking for almost 6 months she's positive. So I think for me, the best thing, go get tested. Don't start having fears and worries and doubts. Yeah, you'll kill yourself. Thank you. We are. Yeah, Nap, I really appreciate. Thank you very much. Still, I'll be taking you through the next lesson next week. So let's meet and do the next class next week, which will be topic 9. Kindly revise well. Also, don't just read notes, be able to apply. The good thing about this topic, you can apply. So really apply. Anything that is not clear, you can ask your lecturer during your tutorials. Have a good time. Thank you. Bye-bye.